So what drugs can you give in patients with heart failure who have borderline blood pressures? So you can give SGLT2 inhibitors. You can give trimetazidine. Of course, the indications are 2B or 2A, depending on the guidelines. You can use diuretics as and when necessary to decrease the symptoms or to decrease the chances of rehospitalizations. If you can follow BNP, of course this is not a very well documented or approved thing, but you can use BNPs to titrate the dose of your diuretics. The other drug that can be used is ARNI. So up to a blood pressure of 100 millimeters mercury in your acutely decompensated heart failure patient, and 90 or even slightly less, I would say up to 80 in some of my patients who do not have postural hypertension. So this is one thing that I always look for. They do not have worsening renal failure even if their pressures are low. They are feeling well. They are not feeling tired all throughout the day. They do not have giddiness when they stand up, or they have not had falls, and they are not very old and fragile. Their frailty index is not bad. So in these patients, even if the blood pressure is low, by which I mean less than 90 millimeters mercury, systolic, I would start them on very low doses of ARNI and watch them and gradually increase, not at intervals of 2 weeks but maybe at 6 weeks. And then many times, to our surprise, to our pleasant surprise, we see that the blood pressure is not actually getting worse, but in some patients actually getting better, and the patient is, of course, patient's heart failure is also getting better. So to make it short, I would say that in patients with hypotension, if they seem compensated and good, do not be afraid of starting do not be afraid of starting ARNI in these patients. Of course, patients with acute decompensated heart failure are a different subset. Here, if the blood pressure is around more than 100, you are comfortable starting ARNI, but if it is less than that, maybe you should wait till the person is more compensated, at which time you can again start ARNI and follow them up.